Today I'm going to be talking to you about fillers and one of the problems that I have with them. Fillers were introduced about 20 or so years ago, and their main function was to add volume, and they work very, very well in adding volume to the lips, to the cheeks, giving structure to the nose. But what I don't think that they're there for is as a anti-aging treatment. Now, the aging process involves loss of volume, which fillers can be used for, but the aging process also involves tissue descent and a loss of elasticity in the tissue, particularly the skin. And this is where fillers unfortunately fail. Now, I see a lot of patients who come in their mid to late 40s, and they have had multiple treatments of fillers in the expectation that in the lower face particularly, and the jowls, by adding filler there, it can help disguise the irregularities around the jaw area, and that will give the impression of them having a lift. But if you think about it, the jowl almost forms a bag of skin, and if the filler is only going to be adding volume to that bag of skin, then it has to fill that bag, and the amount of filler that's required to do that is quite a lot. And sometimes I hear that patients have had 3, 4, 5 cc's injected just into the jaw area, which is an incredible amount in such a small place. And what it ends up doing is, yes, they end up getting a straighter jawline, but with the addition of that volume, it really does change the shape of their face. Now, a youthful face tends to have a heart-shaped appearance, and as we get older, the jowls make it a little bit more rectangular. Now, the thinking behind the addition of adding the fillers is that by straightening the edges out, we can try and achieve a slightly more angular, heart-shaped appearance. But what it's actually doing is creating even more problems and exacerbating the problem that people are already going there for. And in addition to not only making them look rather strange, you've also now got a lot of cc's of product in that area. And sometimes patients have had repeated treatments, and despite what you might hear that fillers only last for 6 months to a year, I know, and certainly a lot of studies have now shown, that they last a lot longer. So these patients have maybe 10, 15 cc's just in this area, which can also lead to problems with inflammation and swelling. So why is this happening? Well, I think that there's a few reasons for this. I mean, number one, I think that for a lot of patients, this seems like a quick and easy fix, and they don't have enough information about other procedures. And for something around the lower face and jowling, I mean, there is only one solution, and that is a facelift. So patients don't have enough information about getting a facelift and what the recovery is, so they just want to kind of avoid that subject altogether. The other reason is that a lot of practitioners don't know enough about a facelift and think it's a very scary proposition, and again, in conjunction with the patient's wishes, they go down this route. I also think that the filler companies, it's in their interest that more and more filler gets used, so they try and expand the area of its use, and as a consequence, they try pushing this lower face volumization and lifting, and help push the product in that way. And I also think that now that the number of people or the number of practitioners who are injecting has widened, so it's not just plastic surgeons who are doing this, there's obviously dermatologists, GPs, dentists. In terms of their business, etc., it's in their interest to be using more product. So I think it's very, very important that patients are fully informed as to what filler is actually good for and what it's not good for. And certainly in my opinion, I think adding more volume to the lower face is causing the trend of now this very, very unusual look that a lot of patients are getting. And then they come through the clinic into my practice where we have to dissolve the filler, but the filler has already caused a lot of scar tissue. So it means that when we do actually go on to do the facelift, that facelift is more challenging than it would be in somebody who's not had as much filler. And also the results sometimes are not as good as somebody who hasn't had filler either. So it's definitely something to think about. And I feel that there is definitely a role for filler within the facial rejuvenation. But I think the lower half of the face is where it should be used with caution. And if you are in your mid 40s, then it's definitely worth a consultation with a plastic surgeon to see if actually there's something else which in the long term will be far more cost effective and also give a much more rejuvenated and better result than chronic filler use. Thank you very much.